EpiZact is an epidural safety device that aims to reduce the incidence of accidental dural puncture. This video will explain some more advanced techniques for using EpiZact. When the green button is pressed down, it interacts with the bottom of the blue grip. The blue grip must be slid all the way back before the green button can be pressed down. When EpiZact triggers, the button pops up, allowing the blue grip to slide freely again. Pay attention to the volume of saline in the reservoir. When EpiZact runs out of saline, the green button will pop up. In this scenario, a loss of resistance space may or may not have been reached. EpiZact should be refilled and reprimed before continuing with the procedure. There are several acceptable ways to hold EpiZact while advancing. The two-handed method involves holding both wings of the blue grip between your thumb and index finger. If you tuck your palms in toward the sides of the grip, it is more stable. An alternative method is to hold EpiZact with one hand underneath the blue grip and the other hand stabilizing the grip while bracing against the patient. However you choose to hold EpiZact, just be sure to hold only the blue grip and not the internal body or plunger, as the blue grip is the only part that disengages from the needle. We typically train users not to touch the needle because it can interfere with the triggering mechanism. However, for more advanced users, it is okay to lightly place your fingers on the front of the needle wings while repositioning, or to provide better control, as long as you are not applying force or driving the needle forward with your hands. In some scenarios, EpiZact will not stay primed when you press the button down. This is because there is not enough resistance at the tip of the needle. When this occurs, the blue grip will not engage. You need to assess whether you are already in the epidural space or if you need to adjust the needle positioning. One risk to be aware of with EpiZact is that in a low BMI patient with a shallow depth to the epidural space, the blue grip will reach the end of its slide length before running into the patient. It is important to stop advancing when you feel EpiZact trigger. If you were to continue advancing, you could injure the patient. For all BMI patients, it is recommended to brace against the patient when advancing the needle. This will help prevent unwanted needle movement, even though the blue grip does not have enough room to reach the end of its slide length. Thank you for watching. For further questions regarding the use of EpiZact, please contact info@guidestarmd.com.